name is Dr. Aisha Augusta Parham, and I work at CMA Global. It is a consulting and searching firm. So we help organizations and businesses with all of their people issues. We have two sessions. One of them will include the history and the best practices of assessments when working with police candidates. So we'll talk about the history of those, what types of assessments work really well with this population, and how to use those in the best way. And then another session we'll be working on implicit bias and incorporating diversity, equity, and inclusion in our work with assessments and in working with police officers as well. Assessments are really a crucial piece of the work that we do as psychologists, right? We can find out tons of information that we won't necessarily be able to gather without the use of assessment. So it gives us really critical data that we can use and apply in all types of ways. So in working with police officers or police candidates, rather, assessments are a really crucial way to see if they are a really good fit for the police department. Are they a really good fit for the community? And are they a good fit for working in the law enforcement field, in general, right? And then also the DE&I piece. So diversity, equity, inclusion is extremely important, is one of our core values as psychologists, is that component of social justice. So we are commissioned as psychologists to incorporate issues such as diversity, equity, and inclusion. So it's really important that we talk about that. How do we incorporate this one core component of our ethical principles into the work that we do with our assessments, into the work that we do with our screenings, and just in everyday work when we're thinking about who's out there serving the public and who's not. Yeah, so I think psychologists are the best suited professionals in our field, in the health industry, period, to work with police officers. I think our training equips us to be one of the best practitioners, to be able to understand human development, to understand human change, to understand what drives our behaviors and our actions. And so with that understanding, with our training, and also with our empathy, with our insight, and with our trainings in assessment, I think it creates a really important kind of combination of a professional that's well suited to work with this population. I like to encourage psychologists who may be on the fence about attending the importance of looking at when you're working with the public and you're working with your patients and your clients, understanding that you're doing an amazing job of helping them in their individual lives. And this allows you the opportunity to help work within those systems that they live in and interact with on a day-to-day basis, right? So law enforcement is one of those systems that your patients are probably going to interact with on a day-to-day basis. And if you're able to, if you feel that calling to help incorporate and use your skill set and your training to help modify and change one of those systems that your patients are going to interact with, I think that's a win-win situation. You're helping that individual. You're also working on those systems that they interact with as well. So that's a part of our work, and I would encourage you to attend and to utilize your skills in an amazing way.